Good afternoon, everyone, and welcome to today's COVID-19 update. Today we have Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw.
Thank you, Chris, and good afternoon, everyone. I'd like to begin today by outlining how we will be sharing COVID-19 updates over the holidays. I know the detailed numbers we post online every day are followed by many Albertans, and even more people are interested in them now with the Omicron variant circulating in the province. I also know that our surveillance teams have worked tirelessly since the pandemic began. That's why for the next week and a half, we will be modifying our reporting to give our teams a break while still keeping Albertans informed over the holidays. Next week, I will hold 2 live public updates on December 28th and 30th. I will provide an overall update to Albertans on the Omicron situation at those times, as well as general numbers for cases and tests completed. We will post our usual detailed data online on the 29th of December, including a daily breakdown of case numbers from December 24th to December 28th. We will provide another detailed daily breakdown of cases following the holiday break on January 4th and every weekday thereafter. The schedule could change and is dependent on the situation we're facing next week, but it is our balance between giving teams well-deserved time off and keeping Albertans informed. I want you to know that this only impacts our public reporting. Our dedicated frontline workers and healthcare teams will keep working every day to look after Albertans as they have done throughout the pandemic. Turning to today's numbers, over the last 24 hours, we identified 1,625 new cases of COVID-19 and completed about 11,800 tests. Our positivity rate is 13.6%. There have been no deaths reported to Alberta Health in the last 24 hours. We have seen a significant uptake for third doses since we opened them up to any Albertan age 18 or older who received their second dose at least 5 months ago. As of yesterday evening, 196,391 booster doses have been booked since we expanded to age 18 and older. In fact, I'm looking forward to getting my own booster dose of Moderna first thing tomorrow. I want to thank every Albertan who has booked their appointment or received their booster. You're helping to protect yourself and others from the virus. If you haven't booked your appointment yet, please do so today. There are currently 318 people being treated for COVID-19 in hospital, including 64 in the ICU. While these numbers have dropped in the recent week, it's important to remember these are still very high baselines and that it's too soon to know what the severity impact from our Omicron cases will be. I want to take a few moments to talk about the spread of Omicron in our province. I also want to remind Albertans of the restrictions in place and what additional precautions should be taken to minimize the risk of contracting or spreading COVID-19. The transmission trend for Omicron in Alberta continues to be consistent with what other jurisdictions in Canada and around the world are experiencing, with doubling times of just 2 to 3 days. This is much faster than we experienced with the Delta variant over the last 6 months. To mitigate this unprecedented rate of infection, we must adjust our case investigation and notification process, as well as making changes to our lab policies. Similar to other provinces, with the growth of COVID-19 cases, we are now focused on investigating cases in high-priority settings, such as continuing care, as well as those who work in healthcare. Cases not in high-priority settings, such as those mentioned, will still be notified of their test result, and they will receive a call to ensure they're aware of their isolation requirements. But we will no longer have the capacity to do full case investigations for these other cases. This is aligned with other provinces and is necessary to ensure our teams are focusing their efforts on the settings of highest priority. As a result of this change, some information will no longer be available, such as where certain cases were acquired and whether new cases are known to have had close contact with other COVID cases. With cases growing exponentially, we must also begin to conserve testing capacity, reserving PCR testing for higher risk groups. This is why we're changing our recommendations today for use of rapid tests. From this point forward, we recommend that rapid tests be preferentially used for those who have symptoms for most people. If you are symptomatic and have access to a rapid testing kit, we encourage you to use that test instead of going for a PCR test. If you test positive and have symptoms, consider that as confirmation that you have COVID-19. Please isolate and notify your close contacts. If you test negative and have symptoms, you should stay in isolation and repeat another rapid test 24 to 48 hours later. If you are negative a second time, you need to stay in isolation until symptoms resolve, and no further measures are required once you're feeling better. This recommendation will help ease the burden on our lab and mirrors a similar approach seen in BC, Ontario, Quebec, and other Canadian jurisdictions. The exceptions to this recommendation are if a person lives or works in a high priority setting, such as continuing care or health care, or an individual who qualifies for COVID antibody treatment because of their clinical condition. These individuals should still get a PCR test, whether or not they've tested positive on a rapid antigen test. For details on what high priority settings are included and for the criteria on who is eligible for antibody treatment, please visit alberta.ca/COVID. The website also has details on what to do if you have tested positive on a rapid test as part of an asymptomatic screening program. I ask that if anyone has a PCR test booked right now to follow up on a positive rapid test, please cancel it to free up space for others unless you meet the high-risk criteria. I also want to be clear that asymptomatic testing for close contacts is not part of our eligibility for PCR testing. PCR tests at this point need to be used for those who have symptoms, and especially those who do not have access to rapid tests. Another change we're making today is to provide additional layers of protection to one of our highest risk settings. Today, we are updating the screening process for staff in long-term care, designated supportive living, and hospice care. Fully immunized staff in these facilities who were known close contacts of a case of COVID-19 will be required to take a daily rapid test for 10 days following their exposure, and if they test positive on a rapid test, they are not able to work. This is one group who would then go on to have confirmatory PCR testing, but until this is complete, they would not be able to enter their workplace unless 10 days have passed from the positive test result. In addition, fully immunized residents in licensed supportive living facilities who are identified as a close contact of a COVID case or who return to their facility after an absence of 24 hours or greater must actively screen for symptoms of COVID-19 every day and must wear a medical mask for 14 days post-exposure or post-return whenever they are outside their own room. Finally, we are increasing the PPE recommendations for anyone caring for a suspect or confirmed case of COVID-19 in a continuing care facility to include an N95 mask or equivalent as part of the overall PPE. We are taking these precautions given how fast Omicron is spreading and given that there are still many things we do not know about the variant. I want to stress that anyone living in, working in, or visiting a licensed supportive living facility must not enter if they have symptoms, no matter what their immunization status is. I also want to clarify my recommendations for community masking that I spoke about on Tuesday. Universal N95 mask use in public settings is not my recommendation. A well-fitting medical mask provides significant benefit, and the evidence is not conclusive that N95 masks provide sufficient additional benefit in public settings to make up for some of the drawbacks of these masks. Individuals can choose to use N95 masks or equivalent, But it is important to remember that a mask alone will not prevent exposure. Outside of the highest risk settings in healthcare and continuing care, where PPE includes not just mask use, but eye protection and other components, my recommendations for masking in public are that masks are well fitted and of high quality, and that use of masks is combined with other layers of protection, such as reducing crowding, improving ventilation, and preventing symptomatic people from being present in a space. With Christmas Eve tomorrow and Kwanzaa beginning on Sunday, I want to repeat my encouragement to all Albertans to cut their in-person social contacts by at least half over the holidays. As I said on Tuesday, our family cancelled our in-person gathering, even though it would have been compliant with current rules. I believe the situation is that serious. I ask that if you plan to gather with others from outside your household over the holidays, please respect the gathering limits in place and take additional precautions. While you can gather in groups of up to 10 adults, it's prudent to keep gatherings as small as possible and limit the number of get-togethers you host or attend. Critically, stay home if you feel even a little bit unwell. If you're under the weather and are supposed to host others, please cancel the gathering. We know that these small actions can make a significant difference when all of us work together. I know this isn't the holiday season that any of us were hoping for. Despite the challenges that this new variant presents, I hope all of us, no matter what holiday we celebrate, can remember everything we have to be grateful for and still find joy in this holiday season. Thank you, and I'm happy to take questions.
Thank you, Dr. Hinshaw. We have the media Q&A now on the phone, so if I can ask the reporters to, you have one question and one follow-up, and then we'll begin. Operator, can you put through the first caller, please?
Thank you. The first question is from Tomasio da Silva, Global TV.
Hello?
Yeah, we can hear you.
Sorry, can you hear me?
Go ahead. Yep.
Sorry. Dr. Hinshaw, can you tell me, we're hearing about really long wait times for PCR tests here in Calgary, but the rest of the province is doing okay in terms of wait times. So why appears that there's a blanket kind of thing that nobody else can have the tests, that they should do the rapid tests?
It's important to remember that with a doubling time of 2 to 3 days, while other areas of the province right now have sufficient capacity, that is likely to change extremely fast. And so instead of making changes that are specific to only one region, again, I'm offering a recommendation that applies across the province for those who have access to rapid tests to use those if they have symptoms. People can still access PCR testing, especially if they don't have access to rapid tests. And so we're not blocking access to testing at this point. We're simply not recommending it because we need to use every tool at our disposal to minimize the chance of transmission, and we need to be thinking forward and be proactive, as we've seen in many other provinces, all those that are experiencing significant Omicron surges. We're seeing that lab testing capacity is exceeded very quickly. So this recommendation applies across the province, again, because I believe that within the next week we will likely need to make additional changes, as we've seen have been necessary in other provinces, and this is just the first step. Again, the most important thing is for people who are feeling ill to stay home and away from others, and if they don't have access to a rapid test, they can still go for PCR testing. But again, we just need to make sure that we have sufficient capacity to be able to have quick enough access to PCR testing, especially for those for whom it makes a difference in their clinical treatment, such as those who are eligible for antibody treatment.
Tomasio, do you have a follow-up?
I do. We are hearing from a number of people, and the stats show that a lot of the new infections are in people fully vaccinated or at least partially vaccinated. What can you say to this? I mean, this seems to be different than what Delta was.
Omicron is different in many, many ways. So one of the differences is in terms of timing. So right now, about 90% of our population 12 and up has at least one dose of vaccine. So just by sheer math, the vast majority of our population is at least partially immunized. And therefore, you would expect that we would have a greater proportion of cases in those with vaccine. The second difference is that Omicron evades immune protection in a different way from Delta, and that's not just with vaccines, it includes those who've had previous infection. So someone who's been infected previously has a much higher risk of reinfection with Omicron than they would have had with Delta. So what we know is that the third dose of vaccine is much more important with Omicron than it was with Delta. And I want to reiterate that 2 doses of vaccine is still looking like it provides good protection from severe outcomes. But that third dose of vaccine is very important when it comes to Omicron, both for protecting against those severe outcomes even better from the person who gets the vaccine, but providing much stronger protection against infection and thereby protecting those around that individual.
Operator, please put through the next caller.
Thank you. Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. Dr. Hinshaw, under this new system, how will Alberta know how many people have COVID?
We have multiple ways of monitoring. So we are using wastewater surveillance now more than we previously were. We have testing results available to the public that are posted online in the different large regions of the province. We also will be continuing to keep track of cases in those who have those risk factors. It will change our surveillance. However, that's something that's being seen in every part of the country as Omicron is spreading farther and faster than anything we've ever seen before. And no one in Canada will be able to maintain PCR testing for every community case with mild symptoms. So this is a change that, again, we are being proactive. We're making in a stepwise fashion in alignment with other provinces. We will continue to have data on severe outcomes that will be equivalent. That will not change our tracking of those who require hospital or ICU care for COVID. And we will continue to keep the public updated on how this change in testing will impact our surveillance going forward.
Carrie, do you have a follow-up?
Yes, I do. Thank you. One of the problems, of course, is that there's a shortage of rapid tests, even with the Alberta ordering 10 million more. How do you deal with that there will be a shortage of rapid tests and now people can't access the PCR test? On top of that, you're asking people to isolate even when they just have symptoms with the negative rapid test. How do you address that?
What I think we can anticipate with Omicron is, again, as it spreads, it is going to become a greater and greater proportion of those who have symptoms. So it's reaching almost 20% of all tests in the Calgary zone. And so as the proportion of Omicron cases goes higher and higher, it's actually quite a reasonable thing to tell someone who's feeling symptomatic that they probably have COVID-19. And we will have to go back to management protocols that we used in the very early days of COVID before we had sufficient lab capacity to test everyone. I also want to underline the point that in the past couple of years, one of the goals of our testing program has been to identify all cases and to minimize onward spread from those cases. Unfortunately, with Omicron, that is not possible because of how fast and how far it spreads. And again, this is not a change that's unique to Alberta. This is something that all jurisdictions are needing to manage, and we will need to provide recommendations. We have updated recommendations on our website and on the AHS website about management of symptoms and working with primary care and other groups to ensure that there are referral pathways that connect people to testing who can benefit from it clinically. So again, this is something that we are moving through along with everyone else in the country because Omicron is radically different from all previous variants of COVID-19.
Operator, please put through the next caller.
Paige Parsons, CBC.
Hi, Dr. Hinshaw. A slightly different topic, but yesterday new stats released from the province show that in just the first 10 months of 2021, it's become the deadliest year ever for drug poisoning deaths. And Associate Minister Ellis, he's pointing to the pandemic and public health rules as being part of a driving factor. What do you think could be driving this record-breaking death toll.
This tragic trend, and it is tragic, every life lost, whether it's a life lost to opioid poisoning, whether it's a life lost to COVID or anything else, is a tragedy and leaves people behind who grieve that person. The different factors that contribute to the increase in deaths, certainly the disruption of people's abilities to connect with others, some of the mental health impacts that isolation brings on, some of the disruptions in where drugs come from.
I'm here today.
Sorry, some of the disruptions in terms of where drugs are coming from and the supply of drugs, all of those are factors that influence it. But it is a critical problem that needs to be addressed.
Paige, do you have a follow-up question?
Yes. You mentioned your family is going above and beyond the restrictions by canceling Christmas gathering plans. Did you recommend that gathering rules be tightened beyond what they are now, or is that something that's on the table for you? Is that something you're hoping to put forward, considering cases are continuing to climb so much?
I'm not able to break cabinet confidence by speaking about recommendations.
Operator, please put through the next caller.
Thank you. Kevin Nimick, CTV.
Hi, Dr. Hinshaw. I think you might be muted in the room. We're not hearing you anymore in your answers. So if you could maybe take a look at that. I can ask my question as well. On Tuesday we saw the United Conservative Party hold a major Christmas party just hours after you provided the guidance that your family had canceled a personal gathering for Christmas, and the health minister provided the guidance that businesses and corporations should cancel their own Christmas parties. Were you disappointed to see this news?
Let me just check to see if my microphone is working now. Are people able to hear me?
We are not.
Okay, let me try now. It sounds like some people can hear me and others can't. How's that? Is that better?
Dr. Hinshaw, this is the operator. It appears we're picking you up on the moderator's microphone. We're still not hearing your microphone.
Okay, so I'm not sure. We're having some technical difficulties in the room, it sounds like. So.
Yes. Sorry to everybody who's following along online. It sounds like we have some technical difficulties with Dr. Hinshaw's microphone. We're looking at getting those sorted out right away here, so appreciate your patience.
Okay, just let me know when you want me to try again.
For those of you who are following along, we are just working through a technical issue with Dr. Hinshaw's microphone, so we're working on that right away, and we will certainly resume the media availability as soon as we have that adjusted and sorted out. Thank you.
You want me to speak again? Is that working now? That's working? Can we check on the line? It sounds different. Oh, maybe that's working?
Hi, Dr. Hinshaw, it's the operator again. No, we're still not hearing your mic clearly. It appears that we're hearing you being picked up through the moderator mic.
Okay.
Thank you, everyone, again for your patience. We're just getting Dr. Hinshaw on a different microphone.
Can I check? Is that working? Is that better? working? Can people hear me now? Is that working?
I can.
There we go.
Okay,
Go
I'm
ahead.
very sorry for the technical difficulties. So the question was about the UCP gathering and the timing of that. I want to be clear that every opportunity for the virus to spread, Omicron will take at this point in time. And at the same time, I mentioned on Tuesday that there may be specific contexts where there's reasons to continue having a gathering that I'm not aware of. However, what I would encourage all of us to do is to take every opportunity to minimize the chances that Omicron has to spread. We know that numbers are climbing very fast, and I think Albertans should expect over the next week or two, especially during the holiday season, that it's highly likely that there will be at least one infectious person present in gatherings where you're gathering with someone outside your household, and should plan and prepare accordingly.
Kevin, do you have a follow-up?
I do. I'm wondering specifically, Dr. Hinshaw, if you were disappointed to see your colleagues in government holding a large Christmas party just hours after you advised that they didn't do so.
The choices that others make certainly are based on risk assessment and understanding of the circumstances. I want to reiterate that it's very important right now to make choices that minimize the spread of the variant, and that it will take every opportunity to spread. But again, everyone makes choices based on what they assess the risk to be. And certainly the rules still enable people to gather together.
Operator, please put through the next caller.
Thank you, Graham Thompson, iPolitics.
Thank you. Just to follow up on Kevin's question, you're saying that people, everyone makes choices on what they see as the risk. Well, there's people out there who think it's not a risk, who don't see a problem with big gatherings at Christmas time and other times. What do you say to them when they assess the risk and go, it's not a risk at all, I can go out there? Unvaccinated, they're allowed to gather according to the rules right now if they're unvaccinated. What do you say to all of them?
I would ask that people consider not just the risk to themselves, but the risk to those around them. We can see if people go and look at the numbers that we're seeing in other provinces that are about a week ahead of us, looking at Ontario, looking at Quebec, you see our future there. You can see the straight line of cases, and we know that it takes somewhere between 2 and 4 weeks to start to see the acute care impacts. So I would say to people who don't see Omicron as a risk, to consider that it's not just about the choices they make for themselves, but that they could be influencing the risk other people face who didn't make those same choices, and to consider that Omicron is different than other variants, and we all need to take significant precautions to protect our communities.
Graham, do you have a follow-up?
Yes, absolutely. So we're into the holidays coming up in a few days, like for 10 days, everything basically shuts down. If things get out of hand, will we have in-person briefings? I'm not necessarily you, Dr. Hinshaw, because you've been working very hard. You deserve some time off. But will we see somebody? Didn't see that in August when the fourth wave began to take off. The government went silent. We didn't hear from your office directly either. Will the government, will your office commit to having in-person updates during the holidays if things go really badly?
I will be doing 2 in-person updates next week, Tuesday and Thursday, and 2 updates the following week, Tuesday and Thursday at a minimum. I'm not sure, I guess we'll see what happens, but I can tell you that I will be here to provide information and answer questions at least twice next week and twice the week after.
We have time for one more question. Operator, can you put through the last caller, please?
Sean Amato, CTV.
Hi, Dr. Hinshaw. The Premier has apologized twice already for UCP MLAs not following the rules. This is the third time now where they didn't exactly honor the spirit of their own recommendations. So please, understand you're being polite, but can you please speak to the frustrations by your department and to health officials when actions like these clearly undermine your efforts for additional public buy-in?
My job is to provide recommendations, to provide the public with specific details on what we know about variants. So I think if I were to sit in judgment of everyone who perhaps caused increased risk, I would not have enough hours in the day. So I will just say that all of us, everyone across this province, we have an opportunity right now. COVID-19 in the form of the Omicron variant is spreading very fast, and in this next week, the choices that we make will have significant consequences, not just for us, but for those around us. And so, again, it's my job to provide Albertans with that information and with my advice based on the current evidence that's available to us.
Sean, do you have a follow-up?
I do, thank you. With the admission of aerosol spread and PPE upgrades announced by Alberta Health, should other essential workers like teachers be provided a safer mask, perhaps like the KN95?
It's really important when considering the layers of protection against COVID-19 to consider an occupational PPE requirement assessment as something that's done as a labor code requirement by every employer to consider all of the kinds of hazards that an individual may be exposed to in the workplace, and then consider what the appropriate measures would be to mitigate that, and to differentiate that from general public recommendations. So N95 masks, respirators that have a tight seal can have negative impacts, and universal use of N95 masks, especially if they're used instead of other measures, or if they're used in kind of an attempt to see them as a silver bullet, will actually not be effective. High-grade medical masks with a good fit provide very good protection, better protection than cloth masks. And so the choice of masks, for example, for teachers would be different in terms of the choice of masks for a healthcare provider who's caring for a suspect, probable or known COVID positive patient. And so again, that is a requirement of employers to determine what those risks are, but the risks for a teacher in a classroom are very different from the risks from somebody who's working in a facility where sick people are presenting for care. And those are the kinds of things to take into account. The incremental benefit from wearing a well-fitting, high-grade medical mask, procedural mask, to wearing an N95 or KN95 in public settings outside of healthcare is not, that's not really clear. And so again, I would say that if somebody in a setting in the general public is wearing a well-fitting medical mask and employing all of the other layers of protection, that would be a solid approach in terms of COVID prevention, and that N95 masks and respirators could be chosen, but I do not believe they would have a sufficient additional benefit to mandate them in all settings.
That concludes today's COVID-19 update. Dr. Hinshaw will be back next week on Tuesday, December 28th for the next COVID update. Thank you, everyone, and have a good day.